Welcome to NSG 217 Study Session 11, Using Bronchodilators. Introduction. In people with respiratory disorders that lead to obstruction of the airway, inhaled medicine are the first choice. They begin to work within 5 minutes and have fewer side effects. The medicine goes right to the lungs and does not easily go into the rest of the body. These medicines are called bronchodilators. The bronchodilators is an agent that causes widening of the airway passages by relaxing bronchial smooth muscles. It allows increased oxygen distribution throughout the lungs and improving alveolar ventilation. In this study session, you will learn about bronchodilators, the clients who need bronchodilators, the types of bronchodilators, and methods of administering bronchodilators. Learning outcomes for study session 11. At the end of this session, you'll be able to 1. Define bronchodilators, 2. State the types of bronchodilators, and 3. State method of administering bronchodilators. Bronchodilators. A bronchodilator is a substance that dilates the bronchi and the bronchioles, reducing resistance in respiratory airway and increasing airflow to the lungs. Bronchodilators are either endogenous, that is, originating naturally within the body, or exogenous, that is, they may be medications administered for the treatment of breathing difficulties. They are most helpful in obstructive lung diseases. Typical examples of these are thus: asthma, chronic obstructive pulmonary disease. The clients who need bronchodilators are A. Patients who have chronic obstructive pulmonary disease, and B. Patients who have asthma. Types of bronchodilators. Bronchodilators have 3 types, and they are as follows: beta-adrenergic, anticholinergics, and methylxanthines. Now, beta-adrenergic. Take a tool. Beta-adrenergic. Beta-adrenergic agonist or beta-agonist are medications that relax muscles of the airway, which widens the airways and result in easier breathing. They are a class of sympathomimetic agents which acts upon the beta-adrenoceptors. In general, pure beta-adrenergic agonists have the opposite function of beta blockers. Anticholinergics. Anticholinergics are a class of drugs that block the action of the neurotransmitter acetylcholine in the brain. They are used to treat diseases like asthma, incontinence, gastrointestinal cramps, and muscular spasm. They are also prescribed for depression and sleep disorders. Methylxanthines. Methylxanthines are bronchodilators used in treatment of asthma and chronic obstructive pulmonary disease, filtered by apnea of prematurity and asthma. Methods of administration of bronchodilators. The method of administering bronchodilators are as follows. 1. A metered dose inhaler, MDI, is a device that delivers a specific amount of medication to the lungs in the form of a short burst of aerosolized medicine that is usually self-administered by the patient via inhalation. Below are the examples of metered dose inhaler. Summary of study session 11. In this study session, you've learned that a bronchodilator is a substance that dilates the bronchia and the bronchioles, reducing resistance in the respiratory airway and increasing airflow to the lungs. Also, types of bronchodilators are beta-adrenergic, anticholinergic, and methylxanthines. Lastly, the method of administering bronchodilators using metered dose inhaler can be seen in 10.3 of this study session. Thank you. We come to the end of this study session.